Anybody? Dr. Johnson, anybody else on your side that's not on yet that needs to be?
No, if they're missing, we'll figure it out. So let's roll on.
Okay. Okay, Ms. Ford, let's like to call the meeting to order. If you would, please go ahead and call the roll.
All right, Chairman Wingate.
Here.
Vice Chairman Smith.
Here.
Dr. Highlander.
Here.
Mrs. Hill.
Here.
Mrs. Jones.
Here.
Mrs. Lennon.
Here.
Mr. McClendon.
Here.
Mrs. Robinson.
Here.
Mrs. Thurman.
Here.
Mr. Taylor. Superintendent Dr. Johnson.
Here.
All right, we do not have any amendments tonight, so do I have a motion to approve the agenda?
So moved. Or second.
Okay, I had you as making the motion. So who is the second?
Second.
Okay.
All right, I've asked Coach Highlander to lead us in the pledge.
We need a vote.
Oh, yeah, sorry. Go ahead.
All right, Dr. Highlander.
Yes.
Mrs. Hill.
Yes.
Mrs. Jones.
Yes.
Mrs. Lennon.
Yes.
Mr. McClendon.
Yes.
Mrs. Robinson.
Yes.
Mr. Smith. Mr. Smith.
I'm sorry, I muted myself. Yes.
Mrs. Thurman.
Yes.
Chairman Wingate.
Yes. All right, Coach.
Okay, if you would, salute the flag of our country. Attention, salute, pledge. I pledge allegiance to the
Flag of the United States of America.
republic
To the
for which
republic for which it stands, one nation,
For
under
God,
God, indivisible, with liberty and justice for all.
All right, thank you, Dr. Highlander. All right, we'll now have a presentation here regarding the Reopening Schools Task Force, Mr. Fogelman and Colonel Brooks.
So we will, let me see if I can share my screen here.
Should be down at the bottom of the page there, Mr. Fogelman.
Right.
There you go.
Okay, Keith, I can start off.
Yeah, Colonel Brooks is going to start off. We appreciate this opportunity to be able to share the work that we're doing, and I'll hand it off to Colonel Brooks for the first few slides.
Okay, well, good evening, everyone. Chairman Wingate and members of the board. I want to thank you for this opportunity for Mr. Keith Fogelman and I to present a brief presentation on the reopening task force. 2 weeks ago, Dr. Johnson appointed Keith and I to lead up the task force to develop a plan to reopen our schools. A few days later, Jennifer Brunson joined the two of us, and we've focused our time and energy to this important task. Now, as a result of the current COVID-19 crisis, our education system as we know it is changing. And even with a lot of unknowns, we're planning and preparing for the upcoming school year. Slide. As we aggressively plan and strategize to reopen our schools, this will keep our community on track to be the best school district in Tennessee. Our reopening plan begins with the Future Ready 2023 school board goals in mind to ensure a safe, clean, and orderly environment that promotes learning in all schools. Our students are the main focus as we plan to reopen in a safe and responsible manner. As the task force committee is formed, we will work on a plan to safely reopen our schools and educate our students. All of us will play a critical role. We're counting on the school board's leadership, your input and guidance as we continue to move forward in developing a plan. And as you can see by this diagram, there are a lot of people involved in the successful reopening of Hamilton County schools. I'll give you a moment to look at the diagram. As our plan evolves, we have identified components necessary to achieve an effective outcome. Keith and I will cover each component in the following slides. Now, you may recognize these guiding principles from the press conference and media coverage. At the onset of the COVID-19 pandemic and quickly going to a shelter-in-place mode and virtual teaching and learning, we recognize the need to support students during difficult times. From the very beginning, our approach to reopening school placed students, teachers, and employees' health concerns as a top priority. The task force research includes, but not limited to, studies like the McKinsey report, a global managed consulting company, state and county health department, as well as CDC guidance. We've gathered information from surveys, action reviews, general feedback showing that not all students had the tools for quality learning from home. For an example, there are students who do not have internet in their homes. We know all the children do not learn the same way, and there are different learning styles that cannot easily be supported remotely. Now, clearly note doing the virtual learning at home was the absence of social-emotional support like school counselors and social workers and school nurses. So as we continue to focus on reopening our schools, we see the need to prepare for anything except for business as usual. These are difficult times, and we will need the board's help and everyone's help. Keith, can you go back to slide 4, please? Yeah, you may see Keith, Jennifer, and I speaking in public about reopening our schools. However, there are many people working hard behind the scenes toward this common goal to reopen schools in Hamilton County. This diagram depicts a total team effort. As you can see by this diagram, the main focus is the student, centered on student learning and focusing on the student, the parents, the community, the teachers, the employees, and all of our community. Keith, can you go to slide 8, please? This slide is just one example. Okay, I'm sorry, next slide, please. Oh, I see what happened, the slides changed, okay. This slide is just one example that when schools are closed, it has a negative impact on all of us. Even though we see value in virtual learning, nothing can replace students in a school classroom environment. When we reopen, we're anticipating support need requirements from students, families, and employees. Additionally, it is likely we could see possible increase in student enrollment from private-based schools due to the economic decline. This completes my portion of the briefing. At this time, I would like to turn the briefing over to Mr. Fogelman.
Thank you, Colonel Brooks. Appreciate that. So as we think about moving forward, one of the things that both Colonel Brooks and I have experienced at in our previous careers is looking at our lessons learned or after action reviews. We've begun that process at Hamilton County Schools. We'll wrap that up tomorrow. And what we want to do is be sure as we think about the lessons from the previous 2 months that we're looking at the things that we did well so we can replicate those, not only in the specific areas but learn how we can carry those tasks over into other areas. We also want to address the things that we identify that we can improve on so that as we move forward, we're prepared to do a better job in those areas. You know, a couple of areas that we've identified here, our operations, the if you get specifically down to feeding the children and the families, you know, that was a case where we were very flexible and adaptive. We learned a lot about digital access and about students having the capability to have access to Wi-Fi as well as one-to-one devices, and then clear, frequent communications being key. And that was a key learning as we move forward about the emphasis about being sure we're clearly communicating, but also just within our own team. We stood up standing meetings to where we're able to look at what went on that day and then plan for the next day. So as one of our top guiding principles and really thinking about building trust going forward, we recognize that first on our list has to be safety and health. You know, as we look at that, we want to focus on compliance and build in the fundamentals to be able to ensure that we're ensuring a safe environment for our students, our employees, as well as our parents and visitors. As we do that, we want to understand what best practices are. We want to be able to recognize that we, as part of the foundation for the guidance from CDC, it's being able to look at options and alternatives for our students and employees that are high risk. You know, monitoring health and safety is critical. Being able to provide screening tools to be able to identify the right health and hygiene practices for implementation and the training protocols that we need to have in place. And really being able to, again, just focus on the communications and rapidly address situations as they develop in our schools. This slide is an example of CDC guidance. It's kind of a gating slide, and we'll use this to help us build a foundation for our phases. We're looking at, you know, first of all, as I mentioned, state and local guidance. We're looking at really addressing our high-risk students and teachers and being able to have the appropriate screening and safeguards in place. Once we start to meet those safeguards, we're able to address other areas such as healthy practices, disinfecting and cleaning areas, social distancing. I mentioned the training. Being able to really just recognize what on a daily basis that what we'll be doing moving through these gating processes so that we'll be able to open the schools and monitor as we're going forward. We've used this slide to help us start to think about how we would go about establishing parameters for risk-based decisions. It's going to be critical and I'll talk just in a moment about the phases, but it's going to be critical for us to think about how we enter into different phases, how we move between them, and how we ultimately maybe exit out of those different phases. So we'll use this as kind of a baseline tool to help us develop a process and a decision-making guide for how we move between phases. I'm going to take just a minute, and you know, as we said here on May 21st, this is what we think that the reopening phases will look like. And depending on the situation that we'll be addressing, you know, we may, as I said earlier, we may be moving between these phases next school year. So what we're trying to do as we build this plan is build the scenarios, the planning to help us to be able to effectively, but also efficiently move between the phases. First phase is really, we've got a significant spread of COVID-19. That's kind of the phase we have been in. Our schools would be closed, and we'd be planning to support students for an extended period of time, potentially an extended period of time. Our phase two would be a moderate spread. We think in that situation, we would possibly have the potential for on-campus school hours with a focus on core curriculum. But we also recognize in this situation, we're probably doing some blended learning. Our third phase is really we've identified that the risk of spread is minimal. At that point, we could have all schools open. Majority of our curriculum delivered on campus, but we would need to be prepared for short-term closure procedures if we identified a building that was affected by COVID-19. We'd have to immediately move into our continued learning, our virtual learning practices for that particular school. And then phase 4, there's really no risk of transmission. Even in that scenario, based on what we've researched to this point, we'll need to be prepared to quickly react if we see a change in the environment around us in the transmission of or spread of COVID-19. We'll probably also, depending on the set of circumstances, have some health and safety practices that we're going to have to implement as we're in this period of no transmission. So as we think about the task force, this is just kind of an example of folks that we think will be a part. We're in the process right now of identifying the task force participants. And one of the things we want to, as we go through that, want to be sure that we get representatives. And while we'll be working with our task force, we'll also be taking input from independent sources. Colonel Brooks and I, we're getting a lot of emails, a lot of recommendations from people, a lot of studies. And so we're factoring all of that in as we move forward. But one thing I do want to emphasize is that we do expect to have continual contact and input from you as our leaders as we move forward. Kind of the next steps. First of all, we'll begin meeting next week with our departments to start to define each of the phases and the actions that we're going to need to take. As I mentioned earlier, we learned a lot in the operations area moving forward. We've learned a lot in teaching and learning. We're going to leverage Neely's playbook that her and her team put together. Jill's working with, her and her team are working on a virtual learning best practices, so we'll be able to implement that. Obviously, weighing heavily or depending heavily on Marcia and her team for student supports. And then, Brent's going to help us with the money, and my organization will continue to provide input for how we handle our staff and put our staff in the best position to be successful. We recognize an important phase of what we're doing is being able to have really a predictable and communication and community engagement. We're planning for surveying our stakeholder groups and really looking as we move forward by the end of June, early July, that we'll have a good plan that we'll be able to start communicating. So questions for Colonel Brooks or myself?
Hey, and let me just say, if I don't see your hand here on the screen right now, when the presentation is up, for whatever reason, it won't let me see participants on the side, and that's usually where I can see hands. So if I can't see your hand on the screen, we'll work around it. Just be patient, okay? Dr. Highlander, go ahead. You're muted, Coach. Coach, you got on? Still muted.
Well, I'm trying.
There you go.
You got it now?
There you go.
Thank you.
Who is our lead medical person that you're getting referrals from?
So we're working through that right now to identify. We're currently, Dr. Adams works with us on a routine basis. We're seeking, I've been in communication with him. He's actually been working with us all through this effort.
That's great. I mean, we've contracted him for that work, so he's a good one, I'm sure.
Yeah, and we're involving the health department. We've got a representative assigned from the health department, and of course we'll use Cheryl Fletcher, who's responsible for school nursing here at the school department.
One other comment or question. Have you considered maybe when we look at alternatives for putting kids back in school, talking to some elementary and secondary teachers, maybe one or two from the urban areas and one or two from the suburban rural areas at each level, and get their take on what they think would be most effective with their students? I'm not talking about being on your committee per se, but at least as contact people, you could, hey, do you think this will work? These are people with boots on the ground.
Yes, sir. We actually plan to have an elementary teacher, a high school teacher, and a middle school teacher on the task force with us.
Yeah.
We're going to leverage those from people that either were on the teacher, Dr. Johnson's teacher cabinet, or had been nominated for that teacher cabinet.
I was thinking, in addition to just one person, if you could have one representing urban areas and one the outlying regions, they have some somewhat different problems from time to time.
Yes, sir.
Okay. Mrs. Hill.
Thank you.
Thank you, Joe. Gentlemen, I really appreciate the work that you're doing on this and the thoughtfulness of your approach. I think it's possibly the most important work that any of us will have to do during our careers. A few things that I felt like were really important that you said that I'd like to elaborate and give a little feedback on. The first, you mentioned parameters for risk-based decisions. I would follow that up with clear predetermined benchmarks for each phase. As we look at the triggers for the different phases, they're kind of vague, honestly. And the thing that I've been looking for as a citizen as we've seen our county and our state close and reopen is there's not been a published benchmark of when we hit this, then we do this. In the way, we read in the paper this week, I was given tremendous hope that Tennessee as a state has overwhelmingly met the recommended testing quantity in a given day, to be able to reopen. And yet we haven't codified that as part of what we're measuring our state's opening against. And so there wasn't the level of confidence from the general public that we potentially could have had in that moment, to know that X number of people in Hamilton County are able to be tested each day, X number of people have unfortunately passed away, and how all that works together. So transparent communication in this time is more important than ever. And so if in your task force work, you could actually assign data to things, if that is possible. So a clear predetermined benchmark for each phase, that we know that phase 1 is not just rampant COVID. Like what does that mean? What's that number mean? What percentage of our population or age group of our population? Things that people can actually measure would be really useful. And then on the other side of that, so once we're in phase 3, for example, the parameters for risk-based decisions, to have those already decided in advance is super important, so that a family knows if COVID shows up at my kid's school, this is exactly what's happening. Like, I already knew in August what might happen in November, and my employer can know that, and we as a community can know that. So a little feedback there. Also about the predictable communication, want to go back to that word transparency. You know, transparency is a couple of things. Obviously, it's meeting out in the open and having conversations and filling people in regularly. And I believe that this team does that. But I did get some feedback after the press conference and then sharing the parameters with my constituents that it felt a little jargony. That what is the role of our schools in public health, for example? And people said, what does that even mean? So to be thoughtful about using phrasing that really is clear and understandable and doesn't feel like it's hiding any information in it would be most helpful, I think, and help us build a foundation of trust as scared families are considering how we're going to all go back to school. And then finally, if we're going to potentially be opening and closing and having remote learning, and people have the choice to have remote learning, you know, our job as a school board not only is to keep these kids safe, but our biggest job is to make sure they're learning. And I understand that it made sense that in the fourth quarter grades didn't count. But we can't live like that. So as Jill is doing the work on best practices for remote learning, I mean, and if families are choosing to stay remote, we need to make sure that we are doing measurement of our student learning and that learning counts toward their grades, so that this isn't going to be a throwaway school year, but it is time when children are truly making progress, and not just the ones who you know, wake up every morning wanting to do algebra, but that everybody does.
Real quick, just to address a couple things really briefly. I think you're exactly right, Jenny, in regards to the target and what I've challenged, you know, Colonel and Keith to look at is to see if we can get to a place where we're dealing with some type of percentage versus a specific number of individuals, because I know it looks different, you know, in each place. But can we look at a percentage from the context of either in our schools, or percentage of students or employees or people in general that have contracted COVID-19 that would be our trigger to move into the next phase? Or as a community, is there a percentage that we look at, or case increase that we look at, percentage case increase that would be our trigger? So absolutely. The other thing I would mention, I think great feedback around terminology and such, and we will have a very clear cadence in regards to what we communicate, you know, and really, we, in fact, coincidentally earlier today just sent an email about our cadence internally with communicating what we're going to communicate on a very regular basis. But then the other piece is around grades. And so if you'll remember, you had the state board and obviously the State Department of Education that the State Department of Education had to bring some proposals to the state board around grading practices and finishing out the year and adverse impacts. And so when the, you know, state board made the decision in regards to, you know, what the implications of grades would be and not having an adverse effect, you know, I don't disagree with that at all as far as that intent finishing out the year. But we have already begun having conversation, you know, in particular with those that maybe control policy to really emphasize the importance of accountability and talking about that accountability. But that's probably one of the top common themes as I've had a chance over the last three or so weeks to just sit individually with teachers in sessions that they've given in regards to accountability and consistency. And so know that's top of mind for us as well. In kind of
I'm glad to hear that. Thank you.
Mr. Smith.
Yes, sir. Guys, Keith, good job. This afternoon, or maybe yesterday, I mentioned to Dr. Johnson, and I think you clarified that, but I want to say it again. The goal is what I'm hearing right now. The goal is to start school on time in this next school year. That's ultimately our goal and our plan. Did I hear that correctly, Keith?
Yes, sir.
Okay.
That's correct.
I think that's important because I'm not real sure the John Q. Public has heard that clearly. So I appreciate you making that clear that is our goal, our hope, and what you're moving towards. So so everybody out there can know that that's what we hope is going to happen. So thank you for making that clear. The other thing I want to mention real quickly, and it's kind of on my radar is I know that in your planning and your conversation, you guys are talking a lot about transportation because that's going to be a challenge, I think. So I hope to hear more about that. Thank you.
Mrs. Robinson.
Thank you both. I just want to tell you that it's an honor to have you guys chairing this task force at the press conference. I had no idea, Keith, the background that you have. I mean, it's just phenomenal. And then, of course, Colonel Brooks, you have a great resume as well. So it's just, it's really an honor to have you guys leading this for our district. I feel like we're in very good hands. I have a few questions. Do you envision that this task force is really more than just a task force that meets over the next few months? Will this group continue the work over the course of the next year, assuming that we'll probably have, fluid changes here and there, or we'll try something, need to shift or steer away, try something else? What do you envision the longevity of this task force looking like?
My perspective is that a little bit of TBD, but recognizing it probably it would not just end by the time we get this, get to the end of June, 1st of July. Because the point you're making is we are probably going to be in a fluid situation, and being able to reach back or to continue to seek input and advice as we move through the next few months, we think would be valuable. So as we communicate to task force members, we'll, while we'll be focused for the short term, we'll also try to lock them up for more of a long-term commitment that maybe not as frequent and nor as intense, but that we do have some capability to utilize their expertise and their input as we move forward.
That's great. That's exactly what I would envision for this group. Because this is really crisis management, and crisis management just doesn't end on July 31st. So I think it's important that the public knows that this is something that this group is going to be narrowing in on for quite a long time, and I think that that's really important. I'm so sorry, my phone will not stop. My other question is, I've been talking to a lot of parents, just really kind of here and there that, on a daily basis are making comments to me about like, oh, if school ever opens, and of course I'm the very optimistic school board member saying, oh, and also parent who wants their kid to go back to school, that school is going to open. It's not going to look like what it did on March 11th, but it is going to open, and we're going to figure out what that looks like. Will this group also bring a suggestion for a policy that should be put in place for any parent that is afraid of sending their child back to school, or feels like they're just not ready to let their child go back to school? Is this group going to be thinking through that obstacle? Because I actually unfortunately do envision that it's going to be a real obstacle for some.
So I'll tell you, Keith, that's probably going to be a policy beyond our committee. You're talking about state level, state board, and know that okay. As superintendents, that's been a conversation we've been having with in the backdrop with the State Department, is around the concern. And I think I shared a couple weeks ago, like I've gotten several emails from parents that have said, hey, I know you all are doing, we'll be doing all you can in August, but I just I don't know if I'm going to feel right about sending my child to school. And knowing that's a reality that we probably will have in August, what are the options? And I would just add that that's one of the impetus for us making sure that we even make more robust our virtual options, because there will be some parents that we have parents on all sides of the gamut, send them to school tomorrow. I'm probably more there. And then parents, well, I'm not sure. And then you have some parents that are like, I don't ever want my child to go back. And we're trying to serve everybody, with the hope that most parents are in the middle and think if we can work through this together, there may be a point where we've got to close the school down. There probably will be a point that we have to close the school down for a period of days, clean it, disinfect it, let the health department do the tracing, and then open it back up and kind of go through. But absolutely, we would completely anticipate that the state will be providing us guidance around waivers and such for those types of situations.
Well, that's good to know that you're already talking about it. I do think that it's important that this board really start thinking about what it looks like if we have to build our own policy for that, because, I don't know when or, if the state is going to give you clear guidance on that or put something in place. But, we need to be prepared to put together our own policy. And so, I just really like to encourage the other 8 of you that, we should really start thinking about that. Maybe just keep it in the back of your minds, because come the end of June, we may not have an idea of what that looks like yet. And we may need to really decide that internally. At least I'm under the impression that, if we had to do that, we could, and that wouldn't overstep anything as far as state guidelines go. Scott may have a different opinion on that or different thoughts. So, but that's all I've got. Thank you. I appreciate it.
Ms. Robinson, to that point, I think what Dr. Johnson says is our best data. We certainly expect that the state's going to give us some guidance about what to expect in the fall for closures. I don't know what that's going to be. I don't know if it's going to be some flexibility about waiver of days. A lot of it's to be determined. There's still more that we don't know than that we do, but I think for us to maybe chart our own course right now would be a little premature, but certainly as we get closer to the start of school, I think we do need to be thinking about having something in place.
Mm-hmm. Well, just real quick, the thought that I have is that if you choose to do virtual learning over being in the actual school building, you shouldn't, maybe, this is just my thought, this is my opinion, that maybe you're not deemed for that as a parent and a student. But again, that's something that perhaps the board may have to decide.
Parents have that option, for virtual already, really, but a lot of times what you see is it not leveraged as much in the K to 8 grade bands. You see it leveraged more frequently at the secondary level, and so what we've really been doing is evaluating really deeply what our K to 5 and 6 to 8. 6 to 8 we're covered pretty well with Edgenuity, but really looking at our K to 5 and making sure that what we have is robust. The other thing that we're not talking about, but is a reality, I kind of mentioned this, we know that we'll have high risk employees that will have concern. That's where I think the board is going to have to be very active in helping to guide us in regards to how you want us to deal with that piece, and obviously we'll have some ideas and thoughts that we can share, but those are conversations that I think are going to be very, very important. Dr. Highlander, are you beckoning me? I saw the finger and I'm just messing. I saw the finger and I started coming your way. So that's what I think is going to be a big area.
Index finger, Dr. Johnson.
I don't know. Yeah.
All right, Mrs. Thurman.
Yeah, I have a few questions. Number one, I think we need a bus driver on this committee. Some bus drivers, maybe like a Jerry Green, someone like that, because we're going to have to bring them in on this. I think that because they're going to have to get the kids there, and I think that's a place that we need to get some input from some bus drivers. Also, parents, we talk about remote learning. I don't want parents to think that it's going to be their teacher doing the remote learning, because teachers can't teach all day and then do the remote learning. They need to understand that is a totally separate program. The virtual learning is a program in and of itself. It's not going to be like their teacher's going to teach all day and then do their kids at another time, you know, and have classes like they have had for the past few months. It's a totally different program. And also another question, Scott, I know that we have a limit on how many people can get into virtual learning. Is the state going to lift that, or are there going to be enough teachers to do that if we give that option out to parents? What? Because I know there's a very limited number of kids who can take the virtual schools, the online schools classes.
I think we can expect that we'll have some flexibility, but I think what's more likely to happen for students who maybe don't come to school because they maybe are in a high risk category, I think what we'll probably do is treat those students as 504 students. And so we'll make an accommodation by giving them some sort of homebound instruction, whether it's virtual or something else. But I think right now what we have to do is figure out what our toolkit's going to look like and be flexible, because different things are going to work differently in different communities. If you have a community like the Colonel was saying earlier, not everyone has access to high-speed internet. Well, you can say, well, we're going to provide virtual learning for kids who are high risk and can't come to school. Well, that's like saying, be happy, be well fed, be warm, but you're not doing anything with it. So I think flexibility is going to be the order of the day. We have a general obligation to accommodate both employees and students, and I think the task force and really all educators are going to be thinking about what does that look like. I know that the state's already looking at some regulatory waivers that, like you just mentioned.
Okay, thank you. And then another question, Scott, I don't know if this is, I just need to know who makes the call about sports. Is that strictly the TSSAA? Are they going to give us autonomy to do that? Just in each area that we live in, like, can we decide to say play football or baseball or whatever? And is the TSSAA going to let us do that? When will we know that?
Well, so because we're members of the TSSAA, every TSSAA sanctioned sport is subject to their board of governance, and they've already kicked around some guidelines. And I don't know if Dr. Robertson is on. I don't see him on the screen.
Yes, sir, I'm here.
Oh, there he is. Justin, you want to speak to that?
Sure. So, Ms. Sermon, we got a report yesterday or the day before that was sent around to athletic directors and principals today from the National Federation of High School Sports that provided some guidelines and parameters for re-entering athletics. We shared that with principals and athletic directors today and presented a plan to resume workouts on June 1st. I can send you guys that report from the NFHS. There are some guidelines around it and some parameters. What we talked to ADs and principals about was what the Federation says is phase 1, which puts some restrictions on, kids not going into locker rooms, limiting the size of groups and keeping the groups together, meaning that if these 10 guys are working out for football, they need to stay together and not intermingle the groups. But I can send that out, and we do have plans in place to return to workouts June 1st. Okay, thank you. I was just wondering about that. Like I said, I think the main thing about this remote learning, parents need to understand that. And another thing, if they start online classes, Scott, can they transition back into the school? Or maybe Dr. Johnson, you'd be the one. Parents just need to know all of this before they make a decision. Can they transition back into the school? Yeah, how does that work?
So I think to your point, Rhonda, one of the things over the next 30 to 45 days we're going to be doing is really getting all the and it's more so in the elementary grade band than it is in the secondary grade band, because we haven't really had a major influx of elementary students in virtual that desire virtual programming. And so that's really caused us to go back and do a real deep evaluation of what we have, how seamless, when you speak to transition, how seamless of a transition would it be, making sure that it's really tightly aligned. And that's what we've been doing over the last couple of weeks and will continue to do over the next month or so. And I think to your point, what also is something to consider is do we have, and we know we will, and this is feedback we're going to have to get in pretty short order, high risk employees, that are in a particular situation that we can use to leverage to help stand up any potential influx at the elementary grade band. But we're trying to be really methodical and careful with it. And we don't want people, we want to be over prepared. We don't want people to go that way out of panic, but we also know and understand that parents do have concern, and we want to be sensitive to those concerns and make sure that what we provide is quality and that we can provide the answers just as you're speaking to in regards to what would a mid-year transition look like. So, I know the president came out and said, hey, we want to have a vaccine by Christmas, so, if that's the case, I say by Christmas, by the end of the year, if let's say that's the case, and I hope they find a vaccine August 1st and everybody can get it by August 12th, and then we don't even have to have the conversation. But I think we've got to be thinking about, okay, what does first semester look like? And what if you have a vaccine by the end of the year? If you have that vaccine, what does it look like for those students to be able to transition back to the normal school, so to speak, in January? Are we ready to handle that staffing wise, and what does that look like? And so that kind of goes back to one of the initial questions from Tiffany. There will be continued work with this body of work over the course of really most of next school year, just because of, the complexities and intricacies of it.
Thank you.
And Ms. Thurman, when you're talking about students, again, flexibility is the word of the day. Let's assume that we're in a situation where there's a relatively small outbreak and we don't have to close school, but there's some advice that folks who may be highly sensitive need to take precautions for their health. In that situation, maybe a child's health plan is they get to go home for a defined period of time. Well, they don't have to go home for any longer than that defined period of time. And during that time, we support them as best we can. So there's already a mechanism existing under state and federal law and our policies to be flexible to provide for the health needs of individual students. So a lot of it's going to depend heavily on what it looks like. Is it a community spread situation again, in which case everyone is going to the house? Or is it a situation where those who are the most vulnerable need to go to the house? Depending on the situation, we've got different procedures in place to take care of it.
Yeah, okay, thank you. And another thing, we might need to think about putting some cafeteria people on this committee as well.
Mrs. Lennon.
All of my questions have been answered.
Okay.
Thank
Dr.
you.
Highlander. You're muted again, Cope.
I think Ms. Thurman is clairvoyant. She's gone from being a PhD to being a soothsayer. She mentioned several things I was thinking about, the bus driver being one. The other was, I mentioned to Dr. Johnson earlier, a week or so ago, I've done some research, and they are offering teachers that either are elderly or at risk, they have made them the assigned virtual, in other systems, they're planning to make them virtual teachers for certain grade levels, certain subjects. One other point, I don't know if anyone's considered, I've had 2 or 3 of my former students who have children in private school saying they're looking at online teaching in the private school. And so they're saying, hey, Dr. Hollander, if I'm not going to pay $15,000 or $20,000 for virtual teaching, but I go public school and do that. So we may be picking up some private school students that we may need to make room for. Thank you.
We make room for any and every student in but yeah, I think everybody here's private, public. I mean, we're all dealing with this, and that's one thing that's a commonality is everybody's dealing with this, and so I think the points all said are very well taken.
Hey, if we don't have any other comments here around this presentation, thank you, Mr. Fogelman, Colonel Brooks. Thank you for the work you've already done. Thank you for sharing this with us tonight.
Thank you. Appreciate the opportunity.
Yeah, thank you very much.
All right, do we have a motion to approve the consent agenda?
So moved.
Second.
Okay, do we have any items we'd like to take a look at? Hey, you're muted, Joe Smith.
Can you hear me now?
I can.
Is Blake Freeman, is he on the line? I just had a couple of questions. I don't remember the number now. I don't have the agenda in front of me, but dealing with the Future Ready Institute, the budget on Future Ready, I'm going to ask him a question if he's there. If not, I can call him.
Yeah, he's not on this afternoon.
Okay. I do have a question about that. I'm sure Dr. Johnson or somebody could probably answer it. So can we just pull that item, Joe?
Okay, let me look here. Is it
I'm trying to pull it up and I've somehow lost it.
It's under grants, federal grants, state grants, self-funded programs. I think it's like
it's
Number 10.
item
10.
10. Future Ready.
yeah, that's it.
10.
All right, we can pull that one.
I'm trying to pull it back up now. I don't know how I lost it.
All right, anybody else have an item they'd like to see? Okay, let's go ahead and vote then, Mrs. Ford.
Hey, Dr. Highlander,
Yes.
Mrs. Hill,
Yes.
Mrs. Jones, Mrs. Jones.
Said yes. Did you hear me?
I'm sorry, I didn't hear you. Mrs. Lennon,
Yes.
Mr. McClendon,
Yes.
Mrs. Robinson,
Yes.
Mr. Smith,
Yes.
Mrs. Thurman,
Yes.
Chairman Wingate.
Yes. Okay, Mr. Smith.
Whoever, I'm probably the only one don't understand this. But when I look at page 2 and I go down and I'm looking at the totals, I look at Saudi Daisy High School and it says 250,000. I look at Brainerd High School and it says 62.5. And I look at Lookout Valley High School and I see 25,197. See those numbers? What my question is, why are they the only 3 schools that are listed here? Is I'm sure there's an easy explanation, but
Yeah, you're go ahead, Brent.
Mr. Smith, the reason that these are the only schools listed is because these are the only schools that have any line item amendments at this time.
okay. All right. So everything else that we've already approved just stayed the same.
Correct.
Okay. All right. Well, I told you it'd probably be a dumb question, but I understand now. So
And it's probably CTE. It's probably CTE related. Is probably some things you're looking at.
okay.
There's never a dumb question, Mr. Smith.
They say there's never a dumb question, just dumb people.
This thing's turning south.
Listen, nothing. Rhonda's going to always tell the truth. So that's okay. That's the reason I love her so much.
All right, do you motion to approve that item, Mr.
Yes.
Smith?
Yes.
Okay.
So moved.
We have a second.
I'll second that from my friend Joe Smith.
You got Dr. Highlander.
Okay,
Oh, Steve.
Sorry. Dr. Highlander,
Yes.
Mrs. Hill,
Yes.
Mrs. Jones,
Yes.
Mrs. Lennon,
Yes.
Mr. McClendon,
Yes.
Mrs. Robinson,
Yes.
Mr. Smith,
Yes.
Mrs. Thurman,
Yes.
Chairman Wingate.
Yes. So that brings us down to board matters there, item Roman numeral 7. And we've got schedule of sessions. I just want to remind you all before I ask for a motion to approve that what we talked about on Monday night was moving that October meeting from the 15th. We backed that up a week to the 8th. So just so that you all and Ms. Ford went ahead and made that adjustment here. So just want to make sure we got that. in public, and also just to remind you all what we're doing here. So do we have a motion to approve the schedule of sessions? Saw Dr. Highlander motion to approve. We have a second.
Second.
Okay.
Dr. Highlander,
Yes.
Mrs. Hill,
Yes.
Mrs. Jones,
Yes.
Mrs. Lennon,
Yes.
Mr. McClendon,
Yeah.
Mrs. Robinson,
Yes.
Mr. Smith,
Yes.
Mrs. Thurman,
Yes.
Chairman Wingate.
Yes. All right, that brings us there to our board policies. Those were all first read. I know we discussed some of those or had the opportunity to on Monday. Any other discussion around those policies? Obviously, we're not voting on those tonight, but do we need any more clarification around any of those board policies? Okay. Well, gets us to the end of this thing. It's pretty quick. We don't have any announcements listed here, but anybody have an announcement they'd like to make?
Mr. Chairman, I just want to share this. I just got a text. I know that Rhonda would probably be particularly interested. David Norton just passed away. David, former judge, just a great man, loved kids, such a mighty support of a lot of my ministries over the years, and he's just a good man. That's just the bottom line. And he went to be with Jesus. So just keep that family in your prayers.
Chairman,
Sorry.
Chairman, I'd also mention, I know it's not our system and not necessarily our community, but from the standpoint of superintendent colleague, Dr. Linda Gilbert, superintendent of Murfreesboro City Schools, just a phenomenal superintendent. I think in 2018 was state superintendent of the year. Just a phenomenal track record. Even when I first got here and got named, I've been in a long time. She hand wrote me a note, just wishing me well on the journey. So she passed away on yesterday, and had a stroke apparently the day before. Passed away the next day unexpectedly. Current superintendent did this. So thinking about Murfreesboro City Schools here in Hamilton County.
Joe, real quick, of course, daycare, school-age childcare is going to be opening on June 1st, and I guess the guidelines or the rules, whatever you call them, that we got today, those are the ones, right? No masks are going to be required of the students. Is that correct? From what we?
Ms. Thurman, I sent an email in that same email about athletics to principals today about SACC, just a couple of announcements there. We had, just for y'all's information, had 5 of the sites that were over the 25 limit that we had set. And we worked today to reach out to families and see if, there were other locations they would be interested in, and we're able to get everybody under the 25. As part of that communication, we heard from several locations concerns about the mask, and what I put in that communication was, basically we're trying to follow CDC guidelines, and it's recommended that kids wear masks. We obviously know that 5, 6, 7, 8-year-olds, the likelihood of them keeping a mask on all day, like Dr. Highlander's grandson there, is probably slim to none. And we're going to communicate that with parents and let them know that, we understand there are going to be times where kids are pulling their mask off, they don't have them on. And we know that that's part of it, and we'll communicate that clearly to parents. There's obviously not going to be any punishment or anything that goes along. Kids are going to be kids, probably not going to wear the mask all day.
Well, in lots of cases, the kids wearing masks, the worst thing they can do, because they get dirty. They'll probably drop them in the toilet. God only knows what else will happen to them. So my grandson is planning on going, but he will be one of the ones that says he will not wear one. He will not go if he has to wear one. So it's going to be interesting to see how that works.
We're gonna follow that same word we've been using, which is grace, and we're gonna work with kids. I think we've got a really good plan. I'm really proud of the work the SACC team has put
Yeah.
into this, and I think it's going to be, I think we'll be good.
Okay, good deal. And next time, I hope, Joe, I hope we're meeting back in the boardroom next time, right?
That's
Yeah.
the plan.
Good deal.
I have a question.
Yes, ma'am.
Do we have the option of not returning back to the boardroom if we're not ready for that yet?
I think
be a
you should
question.
if the state hasn't lifted that
If we-
policy. I think you should be allowed to not.
I think legally you can. I think that if the board wants to give that option to folks who maybe feel it's more prudent to stay at home, I think under the executive order, we have that latitude.
All right, Mrs. Hill, did you have your hand up there?
I do. So that discussion of when we go back into the boardroom goes hand in hand for me with this conversation about regulations about masks or versus grace versus practicality. Justin, it really concerns me that the first pushback on a standard that our district has set as what we intend to have for the health and safety of our students, that we would say, well, we know it's really not going to work. Just do your best. For our task force, the standards that we set need to be practical enough to be implemented with consistency across every single site. And if we have a recommendation that is foolish, that is not going to be able to be implemented, then we shouldn't have that as part of our plan. You know, if we got to think about that, and we can't begin undermining ourselves day -2 or negative week and a half before something starts. So,
Ms. Hill, let me be clear about, so we probably should have made a two separate statements about masks. Our employees will be wearing masks, and you know, we're going to have kids in small groups. That's why we set, you know, the numbers so low, and they're going to be the same group of kids, be outside as much as possible. I think we probably should have made two separate statements in our communication about masks. I think that, you know, if kids are inside and they're in a small room, then they would wear masks. But for a kid to be outside playing on a playground or, you know, running around, I just don't think we clearly communicated initially like we should have, and we are trying to clear that up.
If I can interject real quick though, Justin, I think as much as it's our communication, you also have CDC guidance, right? So the CDC guidance isn't very it's not very directive when it comes to cloth mask. There's specific guidance around cloth masks that says, you know, the students under the age of 2, they don't even recommend them wearing them. And then when you get to 2, there's acknowledgement even on the CDC's end that there will be moments of difficulty with children wearing masks, et cetera. And so, you know, I think it's us also saying, you know, we're deferring to CDC guidance, and that's what the CDC guidance even acknowledges within the context of their messaging. And so, you know, it's going to be a real opportunity for us to continue to refine. And you know, here's what I continue to say, you know, this is a controlled environment. Here in about 2 months, we're talking about 44,000 students coming in schools, and there will absolutely be lessons learned, you know, as there always are, and whether it's communication or whether it's operationally, that will absolutely, you know, take from this moment in time. But again, I want to echo Justin, the standards that have been put in place, we feel really good about. Justin had an opportunity. We connected with the COO of, I was talking to the CEO at YMCA, Joe Smith actually connected me with her about some programming, and got their COO connected with Justin, because they have been operating childcare facility camps all throughout for essential employees, medical employees. And so we're able to learn from what they're doing a little bit as well before we opened up ours. So,
well, I mean, case in point, I mean, Keith mentioned after action reviews. Well, to me, we need to have one right now, this second, about opening up these sites. And how we've communicated, it wasn't as clear as it needed to be. Potentially the recommendation was confusing, and like, you know, I get it that CDC is confusing and that Tennessee is confusing, but these are our Hamilton County students, and we talk about Hamilton County schools leads. So let's lead in this. So as that's how we're going to get trust. And I think that as school board members, when school starts, if we're at phase 3 and I walk in, the same way I'm going to see a clear learning target in Lookout Valley Elementary School, I should be able to see that in Hickson Elementary School, and I should be able to see it in Red Bank Elementary School. I want to see the same safety precautions being taken, not because somebody's in a foul mood one day that they just don't have to do what we say they have to do. And the school-age childcare program is a program of choice. It is not the same. We don't have the same requirements to provide that we do public education when we go back in August. So some food for thought there. Regarding our group coming back together to meet, many of us, myself included, have expressed a desire to see one another, to meet again in public. And I think for the public itself, that is the ideal. I don't want that decision made in a loosey-goosey way either. Karitz's question of what if we're not comfortable is a fair and safe question to be asking right now. And I think this task force, those same triggers about percentages and benchmarks, that should apply to our board's decision to regroup in public. And certainly whatever decision, like, we set the tone. So whatever safety precautions we need, if we all need to wear masks when we walk in that building, then I think every one of us should wear masks out of respect to the policies that our board creates. So let's not get loosey-goosey. I mean, I've been to Home Depot and been in line and seen somebody in a huff that just pushes through the line and acts like a jerk. Let's not be those people. Let's set a tone and be methodical about this.
Joe, if you don't mind, the CDC guidelines are mostly for employees, not for children. And the reason you didn't have more than, they expected a big influx of kids to sign up for the child care program. And this is why, because a lot of it was requiring masks for children, which is not going to work. I don't care. We can make all the rules we want. And it's not going to happen. And like you say, we don't need to make rules that we cannot enforce, and we cannot enforce that rule. Kids are not going to wear them. They're dirty. They can't keep their hands off of them. They drop them in the floor. Where are they going to put them when they go out to recess? You're going to hang them all up with their names on. Who's going to touch them? What's going to happen to them? And as far as a school board meeting, we're a fine bunch to tell people we're ready to send kids into school, and we can't even go. The 9 grown adults can't even walk into a room and safe distance from each other. We did it before. I don't know why now we're trying to tell kids they need to go back to school, and teachers they need to go back to school. But hey, as school board members, we're not cool with that. I don't like the way that looks. I don't like the way that looks. And maybe you do, I don't. But if we have these schools that are built for 800 kids, if we can't get 25 kids in an 800 student school and feel like that they're safely away from each other, goodness gracious, that's all I'm going to say. These schools are huge. You could put 100 kids in there and they would not even see each other all day long if that's what we chose to do. So I just think this is ridiculous to say we can't get 25 kids in a school that has a huge auditorium, a huge gym, and they have to wear masks to keep from getting germs from each other. This is absolutely insane, and this is my opinion. That is crazy time. I'd rather you have my grandson outside on the table, make him sit outside all day in a tent, as to have to wear a mask all day. It's probably going to do more harm than good.
Mrs. Jones.
So I just want to make sure something's clear for the record. Whatever you all have decided, what we've decided as a board in a district to do for student child care for the summer, I am in support of. I mean, we know children, that is a difficult task. I mean, just clearly that's a difficult task. I have a little 5-year-old niece, and she wears a mask, but I mean, everybody's constantly on her daddy and them. Don't put your hands out your mouth, get your hands out your face. So that's a tedious task, and she'll be going to kindergarten. As for returning to the board, that's really what I want to speak on. I think as an adult, we have the right to make that decision. I know for me and my family, we have done worked very hard to social distance. I haven't even been to see my grandmother and my mother, and that's my mom. So nobody on this Zoom is more important to me than my mother. She's the only parent I have left. So if I choose not to go into my mother's house, I can choose not to come into a board meeting where I don't feel comfortable unless I know and I'm safe in the decision and coming based on what the seating arrangements are. I have an 11-month-old baby that I've waited 20 years to have. I want to be around for him. I have a husband. I mean, there are people in my life, and based on some experiences I've had in the past year and a half, emotionally and mentally, I'm not in a sick or to lose anybody else because I made a decision based on what somebody else thought about my decision. So with that being said, unless the law from the state of Tennessee tells me I have to come into a building with you, Rhonda, and anybody else on this board, until I'm comfortable with that, I'm not coming back in. And I'm just going to put that out there. And you can feel like I'm insane and we'll agree to disagree because I think you're sane. I think I'm sane. We both have different opinions.
I'm not saying you're insane. I'm just saying if we're going to ask other people,
I didn't cut you
and
off.
And I don't care what you do, Chris.
Hold on, Rhonda.
I don't care.
Joe, I didn't cut her off. So that's
All right.
to gain control of your meeting. That's only fair.
Well, we can agree.
So I just wanted to state that I think that it's unfair to say that people. I think it's unfair to say how somebody should feel about something when we're in a pandemic. So I just wanted to share that, and I think it was unfair to be cut off because no one cut her off.
All right. Well, do we have any other announcements we need to make?
Do we need to vote on it as a board as to whether or not we're going to have the meeting? How do we need to decide this?
Well, so I mean, as far as I'm concerned, I mean, it's the state of Tennessee is already distributed guidelines about what can or can't happen. Then, I mean, we know what can happen. The reality is as Mr. Bennett has spoken to earlier, is do you make a decision at some point to go, okay, here's what we can do. What would we allow for? And I mean, that's something that I mean, we're going to be in a different place 2 weeks from now. We'll know a whole lot more than we do right now. And I don't know. I think the thing for me of all this is, and I said this before, I mean, we're in a place nobody's been in. And the other thing that I think has been really so much more different in my lifetime than probably anything else is just the speed at which this thing evolves. You know, when you talk about, we're sitting here talking about when school's going to open, when it's not going to open, all that. I mean, I talked with a couple of parents here in the last couple of days, and the reality is that all of you know how much life has changed just in the last 8 weeks. I mean, we have no idea what we're going to be looking at just from national and state guidelines, and we just don't. Right now we know that they've said June 1st. Here's the first phase of what you can do, and my suggestion would be let's get to June 1st and let's see where we are with things, and then if we need to revisit, we need to get counsel from our attorney to talk about what's allowable or not allowable. I think we can do that and go from there. Dr. Highlander.
Thank you, Chairman. Am I on?
You are.
Okay, thank you. While I agree with Rhonda to an extent that I would like to come back publicly, but I also agree 100% with Caritza. If anyone is not comfortable, I think we need to, as Mr. Bennett said, give them the option to Zoom in, and that way that meets both sides are taken care of. I think we can meet public and hopefully have a safe distancing practice there. But then I think anyone who feels uncomfortable should have that 100% option to Zoom in and their vote counted and everything else. So both sides can be taken care of. Thank you,
Chairman.
Yes.
Really quickly, just one thing I remind the board of: the very first meeting that we had when the pandemic started, there were some in the room and there were some online, so we can work through that. You know, I think that's just, we can work through that. The executive order that the governor signed gave elected bodies through June 30th, so there's flexibility. There's definitely flexibility there. I do want to just share, there are a couple of really exciting things that happened in our district. We had 3 schools named national model Padea schools for critical thinking, CSAS upper and lower, and CSLA. And then today, I'm sure it'll be announced a little bit later, Miss Ashley Wilson principal at Nolan Elementary. I know that Kathy, we were able to do a surprise announcement from the National Principal Association group. She was the state principal of the year for that association. We'll go on to the national and go to Washington, D.C. if we can ever get folks, if we're ever flying and going to Washington, D.C. again. So anyways, looking forward to that. So some good things are definitely happening, and looking forward to continuing the work, getting ready for the summer. So thank you all.
Mrs. Robinson.
Yeah, I just had a quick question for Brent, and maybe Dr. Johnson too. I know the state is slated to make cuts to the education budget on the state level due to COVID, and I just wondered, do we have a sense of when we might know more about how that will impact Hamilton County? And if so, perhaps if it's a lengthy situation, that maybe we'll have a work session around that at some point. That was with a question mark.
Yeah, so as of today, we have not heard anything definitive that education will be cut. I know that the legislature is going to consider cuts across the board, and that could possibly include education, but we do not have any definitive indication that education would be one of those areas that would be cut. However, if the BEP funding is cut, we would just have to evaluate the impact for our district. So, for example, 5% cut in BP would be about $8 to $9 million for us, and we would then have to evaluate the budget along with sales tax revenues and other revenues, and see what sorts of costs we might need to cut, and then also evaluate with the board what we would be comfortable doing by using fund balance.
Okay. And do we have any update from the county on their budget, or do you expect us to know more when the mayor has his meeting next week? I think it's next week.
Just two updates I can provide. We received our May BEP estimate a couple of days ago, and it does not show any cuts. It's the same as it was in April. So I think the June, July estimates will be critical when we get those from the state. As far as local taxes go, we don't have any additional information from the county. The mayor presents his budget next Tuesday, which includes our budget, and we can see if there's anything new at that point. I will say that we still have not received our sales taxes yet from the trustee's office. We should get those any day now, but we have had some conversations with the trustee's office, and it appears that our March sales taxes are going to be about even with last year. So we expected possibly up to a 5% decrease because of that last week of March. But I think the growth from internet sales, as well as just the pandemic buying that happened at the end of March, it looks like we're going to be even with where we were in March of last year. So we'll wait till June to see what April looks like.
I think all the toilet tissue and buying may have helped us a little bit.
Clorox wipes.
Clorox wipes.
Toilet tissue.
Paper towels.
Tucker, did you have something? I saw you had your hand up.
Yeah, no, that last part that Brent answered was my question.
Okay.
And I have one quick little question, and I should know the answer to this. Brent, does the BEP funding go to the county commission, or does it come straight to us?
So I think technically it flows through the county, but the county commission doesn't necessarily have any authority over it, other than it has to go to schools. But technically it flows through the county.
It flows through the county. And then how long do they normally hold it before they give it to you?
Okay, so in terms of the cash flow, we get the money directly from the state. It's just included as part of the county's overall budget.
Okay, thank you.
All right. If we don't have anything else, going once, going twice, meeting adjourned. Thank you all.